Hello, professionals. My name is Donna Edwards, and I am going to provide you with some continuing education units so that you can enhance your knowledge. I am a certified addiction treatment counselor number 4 who is accredited by the Addiction Counselor Certification Board of California. I have worked in this profession for over 20 years. I am a CEU provider approved by CATIE, California Addiction and Drug Educators. So with treating co-occurring disorders, the then and now concepts and treatments of co-occurring disorders. In the 1960s, major drugs, alcohol and nicotine, mental health patients in institutions, addiction programs focused on hospital-based detoxification, no long-term recovery programs, Alcoholic Anonymous, the only community-based recovery, limited psychiatric medication availability for mental health patients, medical and psychoanalysis models. In the 1970s, mid-1960s drug, marijuana, LSD, amphetamines, and barbiturates. Now, and more effective medications to treat MHD. Deinstitutionalization of MH. Gender, racial, and other consciousness raising and empowering movements. Flourishing of therapies focus on personal growth and involvement of clients in process of changes. Federal and state government legislations and funds. New professional titles: substance abuse counselor, mental health, professionals, rehabilitation counselors. Most treatments of SAD and MHD operated separately and not combined until the 1990s. Genesis and early concepts. In the DSM-3, which was in 1980, created the framework for co-occurring disorders, laid the groundwork of developing conceptual models for co-occurring disorders, identifying a term, dual diagnosis, dually disorders, mentally ill chemical abusers, mentally ill substance abusers, chemical abusers, and addicted. Federal government agencies initially used the term co-occurring disorders. Researched by Regitly, Goldman, and Talabat in 1986, reports based on the research between 1986 through 1988 based on visiting treatment sites by the same researchers recommended the cooperative treatment arrangements for co-occurring disorders. Important facts founded by the National Institute of Mental Health. The dually diagnosed in SA and MH are greater in number than had been thought. Untreated co-occurring disorders have significant consequences for both individuals and community. No proposed treatment models were based on research outcomes. These two reports sparkled an increased awareness and more research for this population. Thank you for watching the video. Next, you'll be taking a quiz. Once you pass, you will receive a certificate of completion with your CEUs that you have earned. My valid provider number will be on your certificate to turn in to your certifying body.